we get, the worse it gets. So, for example, if you look for the median nerve in the carpal tunnel, it will be perfect, as you see here. And if you go for the sciatic nerve in the depth, it will be a disaster, and you will maybe identify the structure, but you will not find the nerve in, at least not in German mean population BMI. This is just a video showing you the nerve. And as the hand starts to move, you see how the tendons, one thing, they're more hyperechogenic, and second, they move and the nerve just dances around. As you, this is the nerve. So this is very easy to assess. And then you will get an axial view, and of course you want to see the longitudinal view, which is this one. And again, you see the nerve in contrast to the tendons entering the carpal tunnel. So that is just a few seconds of ultrasound and you already see the structures. And it's very easy, it's very straightforward. So I can only encourage you to use it in any occasion, because we as surgeons, we are used to see the structures in anatomical reality. And to add on the ultrasound is just another way of seeing it. So I guess with the anatomical knowledge we have, I guess we are the best persons to use it. This is, for example, taken from the beautiful book from Per from Austria, a median nerve axial view. And this is the compression in the carpal tunnel, and you can see it longitudinally perfectly with the diameter that is then decreasing. So the next big thing, and I guess this is something very important, not only in North or, well, it's important all over the place, is for nerve trauma. And you don't, of course, if you have the possibility of MRR, it would be perfect, but the ultrasound not only depicts the normal nerve, but also the altered nerve. So this is, you can see the fascicles. This is a real damaged nerve. And you can see perfectly the increasing amount of nerve damage according to the Sunderland classification. And on top of the clinics, this also corresponds to electrophysiology. So just with ultrasound and just with the imaging, you already have a lot of additional information that will facilitate your decision on how to treat this nerve. So once again, just go for it. This is axial view, ulnar nerve. This is the neuroma. You see there's no fascicular structure in it. And if you look at it in a longitudinal way, you can see the nerve. You can see the disruption of the nerve. So Sunderland grade 5. And then again, you see the normal nerve. And this is just by putting on the probe. And once you get used to see nerves on ultrasound, you don't want to miss it anymore. Once again, the schematic drawing of a complete damaged nerve with an intact continuity. And this is the nerve with a partial lesion, and some fascicles are still intact. So again, you already saw this nerve. This is a pre-op. And of course, you can use this nerve also intra-op. 6-year-old boy, cut at the wrist. And this is how the nerve looks like once you dissected it out, and then you see it in ultrasound. So you see the nerve axial view, you see the disruption of the fascicular structure. This is proximal, where you perfectly can see all the different fascicles. Then you see nothing at all. And once you pass through the nerve, it's there again. And same is for longitudinal view. I will show you here. This is distal. This is the lesion. We go into the lesion, and you see that the pattern of a normal nerve is not visible anymore. So for nerve trauma, is actually a perfect tool to enhance. This is how this nerve looked like in surgical reality. We grafted it. The boy developed perfectly. So use it. And the second big section to use it is the tumors, of course. It is very easy to put on. You see, this is a schwannoma, so an intraneural tumor. You see the tumor, you see the intact part of the nerve right before the tumor. You can even see the intact fascicles being displaced laterally, as you can see here. And the same thing I will show you in a video. So this is radial artery. This is the median nerve. This is in carpal tunnel. You see the tumor. You see the next tumor that I just showed on MR. and then you have the normal nerve again. Another example of a plexiform schwannoma. This is in the median nerve again, and you see all these tumors lining up one after the other, as in the beautiful drawing of the famous book by David Klein and Alan Hudson. Then there are more rare conditions. I just wanted to show you. This is in the recent years, we saw a lot of this with these torsion nerves. This is a whole nerve torsion. You can see here. And again, the ultrasound indicates perfectly the point where exactly the torsion took place. So it's low cost, it's very fast learning. Once you get used to it, you will feel naked without it. And keep in mind that the depth of structures is always making ultrasound more difficult. So there's absolutely no reason to not use ultrasound in peripheral nerve surgery, and just do it. And this is our beautiful team. And whoever is interested in nerves, we will have during ENS a whole day dedicated to nerves. So please feel free to visit us. Thank you.